This video continues Chapter 11 of OEC 6, looking at altered mental status. We're going to focus on the definition of altered mental status and some of the causes using the mnemonic device AEIOU TIPS. Some of the key terms that we'll look at are related to that mnemonic device, AEIOU TIPS. We'll detail that in just a minute. Now, for anatomy and physiology, one of the basic purposes of the nervous system is to sense the environment, react to it, and maintain homeostasis. Now, along with that, we get some of these highly evolved functions, speech, locomotion, and intellect, and it's when the brain loses its ability to respond appropriately due to a change in homeostasis, we get altered mental status, and that will present itself as a change in some of these key functions. We can look more deeply into the anatomy and physiology of the brain and the three major parts. So the brain stem, which we find at the base of the brain, is really critical for some of those essential to life functions, such as breathing and heart function. Sometimes this is called the lizard brain. It just maintains a lot of those involuntary pieces. The cerebellum, which we find at the back of the brain, just above the brainstem, is important for some motor pieces, balance, coordination, and movement. And the different parts of the cerebrum work in some of the higher order functioning. For example, the temporal lobe, which we see here, is responsible for hearing. The occipital lobe has lots of functions related to vision, and the frontal lobe controls some of those pieces such as emotion. Memory is found right at the base of the cerebral cortex in an area called the hippocampus. When we look at altered mental status, we want to just consider that it's going to present as a change in responsiveness of the patient, and it may include abnormal behaviors, confusion, or what we would say is delirium. We may have a person with motor weakness or balance problems because of some effect to their voluntary ability. We may see people who change emotionally and become combative. We may see sensory issues such as vision loss. Altered mental status is not a diagnosis, but just a general term indicating a malfunction of the nervous system. Now, the reason for that goes back to some change in the ability to maintain homeostasis. So that could be hypoxia, it could be hypoglycemia or low blood sugar, it could be something like sepsis, it could be a nutrient imbalance, which we may see, for example, with uremia. Regardless of the source, the exact cause may not be clear to you in the field. However, in terms of considering possible sources, we have this mnemonic device, AEIOU TIPS. We'll detail that as we continue. The A in AEIOU TIPS stands for alcohol and acidosis. Alcohol effectively has a central nervous system depressant function. Acidosis can result from change in the body's pH and its corresponding change, that is, where the pH doesn't fall below normal levels but is above normal levels, is called alkalosis. E could be either epilepsy or a change in the environment, change in body temperature, an environmental injury such as heat stroke or hypothermia, or a change in electrolyte imbalance. The first I in AEIOU TIPS stands for insulin, which is the hormone that regulates blood sugar secreted from the pancreas, and so any condition such as diabetes that affects production or use of insulin, and therefore the amount of glucose that's in the bloodstream, is going to result therefore in a possible change in mental status. O stands for oxygen or overdose. So remember, minor decreases in oxygen levels, hypoxia, could result in an immediate decrease in CNS functioning. Overdose depends particularly on the type of drugs, but in the case of opiates or other depressants, we're going to see decreased oxygenation, possibly due to slowdown of respiration, heroin and fentanyl overdoses would be representative of this issue. U stands for uremia, which is the inability of the kidneys to remove waste products from the body. Consequently, those toxins will build up in the bloodstream and can result in altered mental status. T stands for trauma, tumors, or transient ischemic attack. Transient refers to the idea that this is temporary in nature, and ischemia is a blockage of blood flow, in this case particularly to a region of the brain. Now, a TIA is reversible. It's typically caused by a small blockage, that is, an embolus, a clot that travels to a smaller coronary artery and consequently changes mental status. However, no permanent brain injury results because it resolves itself. TIAs can be an early warning for a more serious stroke. Dehydration is essentially an environmental condition that could also cause AMS. Infection, or sepsis, can lead to septic shock and can be resident in the central nervous system and therefore affect mental status. P stands for poisonings or psychiatric conditions. There are a small percentage of patients that we could encounter with altered mental status, and that's because of a behavioral disorder or psychiatric disorder that they may have. We may encounter other issues for altered mental status, such as Alzheimer's or dementia, and this would be perhaps consistent with elderly patient populations. S stands for seizure, stroke, syncope, or sleep, and seizures refer to that condition of epilepsy where we have an electrical disturbance within the brain, and these can be either generalized or focal, and they can have motor symptoms associated with this or changes in sensory inputs as well. Stroke is that next step beyond a transient ischemic attack, and it could be from a low blood flow or lack of blood flow, either due to clot or hemorrhaging in the brain. Syncope is a temporary loss of responsiveness, a disruption in blood flow. We can think of it just in this everyday term of fainting, or the final S in AEIOU tips, sleep deprivation, can lead to altered mental status, slower motor function, and even irritability. AEIOU tips is a nice introduction to the possible causes of altered mental status.